So the first thing you look at usually, like in a standing position, kind of one thing I do is have the person put their feet together. So we'll look at like a big global motion first. The reason we get someone in this kind of position, this is like the anatomical position, but it also allows us to start looking at all the joints to see how they're moving. So from here, I'll just have them rotate to the right as far as they can go. Good. So what you're looking at? You're looking at spine, thoracic, lumbar, and the hips. How are they moving? You can even come in and help them a little bit. So all the way. Boom. Ideally, their opposite shoulder should come through, and you should be able to see it on the other side. That's a good test. Let's try that side. Cool. Good. Same thing here. This is the perfect position to be standing, so I can see where his shoulder comes, see how his spine moves, see how his hips move from here. Good. Come back. The next one we like to do is that overhead squat. So bring your feet shoulder width apart, arms above your head, and just squat down. Nice. Come back up. So here, a couple things you're looking at. I'll step out. See, let's do it again. Good. How do their knees look when they squat? Do their hips dive in? Can they maintain that upright position? A couple things. We can look at it from the front. We can look at it from the side. This one will tell us a lot more. You look at the spine. When's the spine bend? How much hip flexion they have, and do they have pinching? Nice. Come back up. So that's a cool little test to see, just to get a general sense of how they're moving. And is there a hip issue? Are your hips mobile or are they not mobile? The last one I'll do in a standing position is a single leg balance. So I'll just have them lift one leg up to my hand here. Good. So let's hold it up there. Now you're looking at stability. Are they dropping? Keep holding it. I like to give them a count of 10. I'm looking at stability of the down hip, stability of the up hip. Where's their pelvis going in relation to the hip? If it's dropping, are they able to engage their left glute to keep their pelvis neutral? So these are a little couple basic things you're looking at in the standing position from here, just to really dive into the hip. From there, we'll break it down into a sitting position. Sitting down takes away joints from the whole scenario. So we'll kind of do a little bit of the same assessment here. The first one I'll have them do is bring their knees together. I'll actually lock them in place. So when you actually lock the hips, you lock the knees, you're not allowing the hips to rotate when you look at the upper body. So I'll have them here, they'll cross their arms to me. So now if this was limited in the standing position, we'll see where it's coming from. Now we're getting to address, is it upper half or is it the lower half? Are we really gonna start diving into the hip? So rotate to your right. Good, and you're looking for that nice 45 to 50 degree angle here. Come back, let's go left. Good. And like just looking at Tyler here, you can see his left is a little more restricted, a little more challenging. We can dive into that further, so we know maybe it's potentially a spine issue, but overall they look pretty even. So from there, we'll kind of go to the hips, right? We looked at the spine, we're trying to clear the spine. I'll stabilize the femur here, and then I'll have them kind of kick their leg out to me that way. Good, come back down. So you're looking at angle, you're looking at pelvis position, try again. Good. So one thing I like to look, if someone has only an active range for about here, there's a little bit of restriction. We actually we want to take it passively. We want to see what's their passive range, so you can kind of stabilize and just do the motion yourself, right? If there's difference between active and passive, we have to dive into that to see what's really going on, because that could be a big issue there. So this is an internal rotation of the femur. We would actually look at external too, so come in as high as you can go. Good. So he's given us a good example here. You see how he kind of flexed his hip when he did it, right? So that we know there's a little restriction in external rotation. So try again without flexing. Good. And that's kind of all he gets. And sometimes too, you can actually look down the chain. Is it coming from the tibia? Is it coming from the ankle? Try again. Good. So you see how his foot starts to move at the end there? He's trying to cheat that extra little bit of range. So we just got to make sure we really address that. So then I'll have him relax and I'll check it passively. Where are your hips moving passively, right? That's kind of an important thing. So he actually has more passive range than active range. So we can start to think tissue. Tissue might be affected. It could be tissue extensibility. It could be that the tissues aren't strong enough. So from here, we'll take him down into a prone or supine position. With supine position, first thing kind of I like to look at here is, how does the hip move on its own, right? Just kind of let it do its thing. Right? You can see his hip kind of comes forward and comes out. Right? I don't even want to guide it. I want to see, where is it going? What is the normal range for this hip? Where is it comfortable? So here, just kind of coming out. And I could see his leg likes to drop out towards me a little bit. There's nothing wrong with that. All we're doing here is just assessing. Like, do we need to dive into this hip? Do we need to do mobility drills? Is it even essential? Because a lot of times people do mobility drills that don't even need it. So you just got to really check. But from here, his hip's pretty good. If someone has a hip pathology, this actually might be a painful position for them because they can either be pinching their hip flexor or their labrum. So there's other issues that could be going on. So just make sure, if you're going to do this on yourself, just if there's pain, you should probably get it checked out. Don't rely on your own judgment. So in this position too, you can actually check kind of internal and external. You know, how's that mobility going? Is it different from the sitting position, right? How does it feel? And anytime you're in the supine position or when you're addressing the hip, you have to make sure the axis of rotation is through the femur rather than anywhere else. So if I'm moving the hip here, you know, is his pelvis moving? Kind of, and you can, I don't know if you guys can see that, but when I take him to full external rotation, you'll see a little dip, actually in the lumbar spine too. You see a little kind of side bending. So then we know we've gone past his maximal range here. So it's just a good general assessment to get, you know, in this supine position. We'll also check prone, get them in the prone position on their stomach. I really like the prone position, kind of, because you're limited or you're restricting motion from the spine in this position, so you can really get a feel of how the hip's moving. So the first thing kind of I like to do is I'll pull the shirt up. There's a couple little things you should look at, just basic kind of knee flexion. So you're looking at the hip flexors right away. So if the hip flexors are tight, you can see if I push him, he gets a little bit of lumbar extension there. In that lumbar extension, the only way that's really moving is because the hip flexors are tight, because they attach to the lumbar spine. So that's kind of a little bit of a test right there. Boom. In this position too, the rotation is crucial. We can really see the rotation. We could see if it's a mobility issue or is it a neuromuscular issue. A lot of times people have great mobility, but they don't have the core control or the core stiffness to control it as they move. So we'll look at external here. Again, we can look at the spine, look at the hip itself, or look at internal. One thing I like to look at internal is the opposite hip pop. Again, same like on their back. If that hip's popping, then we know that we've gone way beyond their anatomical range. So kind of sometimes I'll come in and give actually a little stabilization to really see where it comes through. In this position, you're actually mobilizing the spine as well, and a lot of people tend to like that. So you just want to see, you want to get a general feel. How's that hip? Right? There's other things you can do too in this position. You can actually check kind of the hip flexor length there, see where that goes. See if there's mobility into extension limitation. You know, with sitting all day, if you have a sitting job, you're probably going to have a hip extension limitation, and that's going to affect your back, your hip, or your knee. There's kind of a gamut of things that can affect. So this is like a basic level mobility assessment of the hip. There's a lot of other stuff we'll get into. If you guys like this video, just put a comment and we'll go through it.